Well, good afternoon, everybody. Welcome to the Subcommittee on Health and Human Services. I am not Senator McRae, but I sometimes play him in committee. Just want to keep everything timely. We're going to start first with the military department, and we'll start with our fantastic budget analyst, Ryan Green, when he's ready to go. Mr. Green. Okay.
Sorry about that. Thank you. Yes. So the fiscal 2024 budget will increase for the military department by 6.6 million or 19% to $41.3 million. Moving on to page 2, looking at Exhibit 1. The military department will receive $540,000 in general funds for deficiencies. $340,000 of that is broken out in the exhibit, and it is for the Maryland Military History Museum. As federal funding has declined in recent years, the Maryland Military Museum will require additional funds from the state to maintain operations. Additionally, at the top of page 3, we can see that they get an additional $200,000 in funding for security efforts surrounding the governor's inauguration in January 2023. Looking at Exhibit 2 on page 3, for an overview of agency spending, we can see that most of spending for the department goes to personnel, with state operations, Army operations and maintenance, air operations and maintenance, and administrative headquarters making up the rest. As a note, the TRICARE Reserve Select Premium Reimbursement Program, which I'll discuss later in this report, is included within state operations, but is broken out here to highlight it. Looking at Exhibit 3 on page 4, which continues on page 5, breaks out the increases for the department, which we can see are largely due to the TRICARE Premium Reimbursement Program for National Guard members, contingent on legislation, as well as 24-hour armed guards for armories and installations for the program. More on the TRICARE Premium Reimbursement Program, House Bill 553 and Senate Bill 554 are administration bills that propose the establishment of a program to provide members of the Maryland National Guard and their families who are eligible for TRICARE Reserve Select to receive health and dental care at no cost. Specifically, the proposed legislation would create a program in the military department that reimburses premiums for TRS members and TRICARE dental programs. It would reimburse in full the submitted premium payments. Exhibit 4 on page 6 provides estimates for premiums for beneficiaries of the TRICARE Reserve Premium Select, which the program would then refund. The department should comment on how it will cover any fiscal 2024 costs that exceed the appropriation for the program. The Department of Legislative Services recommends adopting committee narrative to request a report on program implementation and the number of participants for each of the 2 premium reimbursement programs, including average premium reimbursement for each, as well as total reimbursement. Moving on to personnel on page 7, we can see that as of January 2023, there are 36 vacant positions within the military department, which is more than twice as many as needed to meet the budgeted turnover. Of the 36 vacant positions, 26 have been vacant less than 6 months, and 2 have been vacant more than 1 year. Despite the high vacancy rate, the department has made substantial progress on reducing it in the last year. The department should comment on their plan to further improve recruitment and retention and how these vacancies may be impacting operations. Additionally, of the 36 vacancies, 12 are for the Free State Challenge Academy. This represents a 50% increase from the previous year. To assist in resolving the high vacancies for the program, the fiscal 2024 budget includes an annual salary review adjustment for military youth workers and counselor classification within the FCA to make the salaries more competitive. Additionally, the fiscal 2024 allowance includes 2 new contractual full-time equivalents for electronic security support at Camp Frederick. Moving on to page 8 for key observations, looking at Exhibit 5, we can see that Army National Guard facility readiness has stagnated since the previous year, and that the fiscal 2024 allowance includes $1.2 million split between general and federal funds for Army National Guard facility maintenance. The department should comment on how the funding provided in the fiscal 2024 allowance will be used to improve the fully functional status of their facilities. Looking at Exhibit 6 on page 9, we can see that the National Guard troop strength has surpassed department goals and exceeded last year's performance. Moving on to issue 3, which begins on page 9, but it's mostly on page 10. We can see that there is committee narrative submitted in response to the 2022 Joint Chairman's Report that detailed progress on the Free State Challenge Academy renovation projects. In response to this request, the department described its efforts, which the department referred to as phase 1 renovations, including converting 4-person rooms into open bays, renovating the HVAC system to accommodate an open bay structure, renovating the restrooms, new LED lights, new exterior doors, and replacing the 3rd floor insulation where necessary. Additionally, the department has identified phase 2 projects, which they are currently working with their federal partner to get a federal contribution of up to 75% of the cost for. The department should comment on the status of these renovations and the anticipated timeline for completion. Additionally, if you look at Exhibit 7 on page 11, we can see that academic performance within the Free State Challenge Academy has declined. The GED pass rate is down to 40.6%, and only 45% of students pursue additional schooling or other opportunities. The declines in performance are largely attributable to the COVID-19 pandemic, and the department should comment on how it expects upcoming classes to perform and how it is addressing pandemic-related learning losses. The final pages of the analysis provide the exact wording for the reports requested, as well as additional appendices. Thank you.
Thank you very much, Mr. Green. Very thoughtful analysis. Seeing no questions. General, welcome. Please come on up. It's great to have you here. Please call whoever else you want up with you, and please start whenever you're ready.
Thanks so much, Senator Zucker. I've got with me my Chief of Staff, Nathan Crum, Director of Legislative Affairs, Catherine Kelly, lots of other staff members here if we have any specific questions that can help me answer. Once again, good afternoon, Senator and the members of the subcommittee. I appreciate this opportunity to update the subcommittee on the activities of the department and to respond to issues raised and recommendations contained in the operating budget analysis prepared by the Department of Legislative Services analyst Ryan Green. Thanks again, Ryan. Thank you, Mr. Green, for your hard work. I'm joined today by several members of my staff in the Maryland Military Department. As you're aware, members of the Maryland Military Department are called upon to serve and protect our communities, our state, and our nation. We are successful by making the most of the talent within our organization. We dedicated to being inclusive and diverse, maximizing the skills and experiences of leaders and members at all levels. We're proud of the team and continue to focus on building an exemplary, diverse team. The highlights of our accomplishments include the Maryland National Guard continued support of multiple overseas, national, and local contingency operations. Our personnel have served in ongoing operations such as Afghanistan, Estonia, Bosnia-Herzegovina, Kosovo, and the Horn of Africa. Maryland National Guard has supported COVID-19 test sites and continued to help vaccinate underserved communities across Maryland. Maryland National Guard also provided support in the aftermath of flooding of Maryland's eastern shore and as a precaution for potential impacts from heavy snowfall in central Maryland and the eastern shore. Maryland National Guard provided flyovers for various sporting events, as well as providing other aviation support for contingency operation missions for the National Capital Region. The Maryland National Guard Counter Drug Program supported state and federal law enforcement agencies in the seizure of illegal drugs, weapons, vehicles, and other equipment valued at nearly $72 million. The National Guard Honor Guard provided honors for 2,132 military funerals, and the Maryland Defense Force managed COVID-19 testing at the in-processing of the Maryland National Guard Free State Challenge Academy, established an American Hospital Safety Institute, started training and certifying people in basic first aid, CPR, high-performance CPR, and provided professional development courses for both enlisted and personnel officers. We did get a chance to provide a response to the various questions and issues that you had. If you like, I can go through them, or we presented them to you. It's up to you how you'd like for us to proceed from here.
No, I definitely appreciate that, Major General. Is there any questions from the committee? I see Senator Jennings.
Thank you. General, I want to ask this question, but I don't know if it's too premature or if I'm opening up a can of worms, but I represent Maryland Air National Guard in my district and 810s.
Yep.
Are we moving forward to try to?
Wow, that is a can of worms. Okay.
And I don't want to put you on the spot.
There's a lot to talk about. Yes. Yeah. Okay. So the current plan on the map, on the road map is that the A10s leave Maryland in February in FY25.
Okay.
We're fighting really, really hard at every level to push back against that. In fact, the Secretary of the Air Force met with our congressional delegation yesterday, and we spent a lot of time with Congressman Rupersberger, both of our senators. They were at the meeting with the Secretary of the Air Force. We had well prepared them for our argument, and that is that we don't have a replacement fighter aircraft for those. The original deal was with that this Air Force made with me was that if we chose between A-10s and C-130s, if we went with A-10s, which I knew was a risk because they were going away, that they would help us get a follow-on fighter if we got the 8,000 feet of runway at Martin State Airport, which the state of Maryland's done a great job in coming up with the funding for that. We got funding from the Air Force for that, and the FAA is promising funding for that. So we've done our share, and the Secretary of the Air Force has other plans. So we're hard at work.
C-130 is an option?
No, they're gone.
All right, thank you. And thank you for all your hard work with that, because it is a major issue we need to take care of.
Thank you, Senator Jennings. And I won't open up a can of worms, but I do have a question.
Okay.
In reference to Free State Challenge Academy, just thank you all first, lean in and say thank you all for the work that you do, and especially Ms. Kelly, just keeping a consistent communication. You talked about in the analysis that there was you were seeking the federal appropriation. Just wanted to get a status update, a brief status update on it.
I'm going to pass that to Mr. Crum to help me answer that one.
Good afternoon, sir. For the record, Nate Crum, Chief of Staff, Military Department. Can I get more? I'm trying to recollect what particularly you were referencing.
On page 10 of the analysis, it referenced the military department currently working with their federal partners to get a federal contribution of up to 75%.
So we continue to work, sir, with National Guard Bureau. They provide 75% of the funding for the challenge program. And as a result, they're the primary drivers of that particular funding stream.
No problem. And I'll take it offline. I'll make sure I reach out to Ms. Kelly. Is there any other questions? Senator Hedelman.
To comment and thank you. I know you have a piece of property in my district that's pretty important to us, and we've gotten to a place where we've been able to work out some of the issues, and I just appreciate your support and helping to transfer, hopefully sooner than later, that piece of property.
Yes, Senator. That's not the only one. In fact, it's something that we spend a lot of time and effort on, is divesting our properties like that. But thank you.
Thank you.
Seeing no further questions, I'd like to first once again thank you, General, for you and your team for your leadership and what you do for the state of Maryland. And Mr. Green, just thank you as always for the comprehensive analysis. Colleagues, we're going to now move on to the Maryland Health Benefit Exchange. And we're going to ask for Ms. Morgan Smith, our analysis.
Good morning.
Thank you, Mr. Chairman and members of the committee. My name is Morgan Smith, and I'm here to present the operating budget analysis for the Maryland Health Benefit Exchange today. This is the agency that works with the Maryland Health Connection. It expands opportunities for Marylanders to get access to affordable health care through open enrollment annually. And on page 1, you'll see that the benefit exchange's budget increases by 40.8 million or 7.1% to 615.4 million in fiscal 2024. The allowance also includes 10 million for the young adult subsidy program, and I will talk about that at length shortly. Skipping over to page 2, You'll see a short discussion on the proposed deficiency included in the 2024 allowance for fiscal 2023. It totals $7.5 million, and it will be used to support increases in the fulfillment and consolidated service center contract rates. The important piece here is that about half of this deficiency is in general funds, and this is the first time the benefit exchange has received general funds since 2016. General funds are believed to be continued into fiscal 2024, and DLS asks that MHBE comment on whether general fund support is expected to be needed in the future for this agency. Jumping to page 3. Exhibit 1 shows the overview of agency spending. The majority of MHBE's budget is used for the reinsurance payments at around 84%, with another 2% being used for the young adult subsidy. The remaining 14% is used for their administration and IT departments. And skipping to the next page, Exhibit 2 shows the breakdown of administration, with the majority or 16% being used for the call center. On page 5, you'll look at the proposed budget changes for MHBE. And the majority of the changes are smaller, with the reinsurance payments increasing about 52.3 million and being partially offset by a decrease of 10 million in the young adult subsidy. Other larger changes include a decrease of 1.7 million in MHBE's allocated costs associated with the utilization of the Amazon Web Server Cloud. On the next page, page 6, you'll see a brief discussion about personnel data. The benefit exchange saw stable personnel between the fiscal 2023 working appropriation and the fiscal 2024 allowance of 67 regular positions. And as of the writing of the analysis, the department only had 0.38 positions above the number needed to meet turnover. We're skipping now to page 8. Chapters 6 and 7 of 2018 established the state reinsurance program to address rising health insurance premiums in Maryland, and it required the benefit exchange to apply for a state innovation waiver under Section 1332 of the Affordable Care Act to seek federal pass-through funding, which will be used to support the reinsurance program. This waiver was approved in August 2018, and in December 2022, the benefit exchange submitted their letter of intent to request a 5-year extension to extend the program from the current end date of plan year 2023 to year 2028. Exhibit 4 that you see on the screen shows the sample monthly premiums for a 40-year-old in a Care First Blue Choice plan. These plans represent the lowest cost plan at each metal level, bronze, silver, and gold, with bronze plans increasing the most on a rate basis of 8.9% and the silver the least at 3.8%. This is the second year since the reinsurance program began that sample rates have seen an expected increase, yet all rates for Plan 2023 are still below those of Plan year 2020. The bronze plan, which saw the largest level of increase, has a rate 2% lower than that of 2020. On page 10, you see Exhibit 5, which shows the actual and estimated reinsurance costs and the federal pass-through allotment from calendar 2019 through calendar 2025. At the beginning of the reinsurance program, federal fund was expected to be sufficient to cover the costs through 2023. However, actual program costs for 2021 were 8% higher due to 8% higher than projected due to the ongoing COVID-19 pandemic. While program cost projections have increased, federal funding for the program has decreased, primarily due to a third carrier entering the market, which resulted in a 27% reduction in federal funding. In calendar 2021, the state reinsurance program was roughly level funded, with revenues slightly exceeding the expenditures due to additional ARPA funds. However, starting in calendar 2022, the program's estimated expenditures exceed federal pass-through revenue by $175 million. The benefit exchange will draw down available federal fund balance and then must utilize the assessment revenue and fund balance to fill in the gap as shown in Exhibit 6 on page 11. The fiscal 2024 allowance includes $101.5 million for provider assessment revenues funding reinsurance. New revenue from the provider assessment is estimated at $135 million for calendar 2023 and is projected to increase by 4% in subsequent years. By calendar 2025, estimated state-funded reinsurance costs will exceed the new assessment revenue by 30 million, indicating that the state must be cautious going forward in committing the fund balance to other endeavors. Exhibit 6 also shows the forecasted balance of the reinsurance funds through calendar 2025, where it declines to $284 million. This decline is not only from the use of the fund to fill in the gap mentioned previously, but to fund legislation from the 2021 session, which authorized using reinsurance funds for other purposes. These purposes are listed at the bottom of page 11 and onto page 12. Also on page 12, you will see Exhibit 7, which is titled Enrollees in Qualified Health Plans by Age. Chapters 777 and 778 of 2021 created the state-based Young Adult Health Insurance Subsidies Pilot Program, also known as the Young Adult Subsidy. And this was for 2 years. It was funded at $40 million across fiscal 2022 and 2024. Exhibit 7 highlights the marginal increases in the under 18, 26 through 34, 35 through 44, and 65 plus age categories from the previous year. The pilot program terminates at the end of calendar 2023, and because of this, MHBE should comment on the future young adult subsidy program plans, including a discussion of pilot results. The next observation that I'll make is starting on page 13, and you'll see Exhibit 8, which shows the enrollment through the Maryland Health Connection. MHBE saw an increase in Maryland citizens becoming enrolled in a qualified health plan in the plan year 2023, with enrollee numbers exceeding 183,000. The red line is the rate of uninsured Marylanders, which has been stable at 6% starting around 2018. Finally, on page 14, you will see the list of recommended actions. Both items are annual language that were included in last year's analysis. The first one would require MHBE to alert the budget committees if applications to extend the state reinsurance program are submitted, as well as a report that allows MHBE to share information on the cost of the reinsurance program and future funding needs. With that, I conclude my remarks, and I'm happy to take any questions you may have.
Thank you, Ms. Smith. Seeing no questions, I'd like to call up Executive Director Eberly.
Good afternoon, Chair McCray and committee members. I am Michelle Eberly, the Executive Director for Maryland Health Benefit Exchange, and with me today, I have my Chief Financial Officer, Tony Armiger. We appreciate the opportunity to address the committee today on our budget. And thank you, Morgan, for your thorough analysis and your hard work to present this today to the committee. Just as a reminder, the mission of MHB is to improve the health and well-being of Marylanders by connecting them with high-quality, affordable health coverage through innovative programs, technology, and consumer assistance. In the decades since our inception, MHB has brought health coverage to millions of Marylanders. You all have helped us along the way by enacting the state reinsurance program, which has reduced individual market premiums by more than 25% since 2019, by enacting the easy enrollment programs, which allow uninsured individuals to connect to health coverage by checking a box on their state tax returns or when they file for unemployment insurance, and by instituting the premium assistance for young adults, which Morgan referenced, and we'll talk a little bit more in our response today. These programs, along with technological innovation, focus outreach and marketing efforts, and consumer-driven customer service, have provided 1 in 5 Marylanders with quality, affordable health insurance. Included in the materials that we posted today is our 2022 annual report. In this report, I'm not going to go through it, but this report wonderfully demonstrates the success of what the exchange does and how we operate and how the achievements we make on a year-by-year basis. So you all have that. We continue to be very successful and provide vital services to Marylanders as a small agency with a small budget. As a budget analysis reports, we have 67 state staff, and we operate with limited state funds and supportive federal funds. It's important to note in our budget, there are 3 different programs. Program 1 covers all of our operations. So that's everything from HR and finance, everything we do on the business side. Program 2 is all specific for IT work, and our IT work supports our backbone, Maryland Health Connection, which is the way people get health insurance. And then program 3, which is the largest amount in our budget, is the reinsurance program. And although that is so large, in our mind, it's just a pass-through, because it literally is a pass-through. It's funding that we get from the federal government and some state funding as well, but it gets paid out to our insurance carriers to cover their high cost enrollees, both on exchange and off exchange. So everyone in the individual market. So that's millions of dollars that come through our budget, but really just get passed on. We've been asked to address 2 specific questions today. The first of which is to comment on whether general fund support is expected to be needed in the future for this agency. And just a little history reminder, when we were initiated, we were established with state funding through the premium assessment tax in the amount of, at minimum, $35 million to cover our operating needs. Since that time, we had underspent that $35 million amount. And so subsequently through the BRFA was reduced to at 32 million, which is what is in statute now for us to have funding through the special fund. As Morgan noted, we had not received any general funds until fiscal year 23, where we expect that this year, through a deficiency request, we will receive general funds. In the budget you have before you, there is additional funding that will come from general funds. So we're not here today asking the legislature for any additional funding, but we will, in answer to your question, now and in the future, we will require more than that at 32 million. And the reason for that, several reasons. One, we get COLA increases, there's staffing adjustments that are made that prohibit us from staying at 32 million. And also the reason why we had that significant underspend for several years were 2 contracts, particularly that we knew would have to be renegotiated in 2022, and they were. One was our call center, which increased greatly. The other one that we did not anticipate increasing so much, but did, is our fulfillment center. So they do all the mailing of all the notices to the 1.5 million Medicaid recipients. They do all of our, a lot of our mailings and notices and return receipt mail, et cetera. Because of inflation, because of the cost of paper, that contract went up significantly. It was much greater than we expected. Nevertheless, we still, are staying relatively close to that original 35 million, but we will be getting general funds 23, 24, and we do expect that will occur in the future. The second area we've been asked to comment on is the future young adult subsidy program plans. This program, as Morgan indicated, was put in as a pilot for 2 years. The idea being that young, healthy people are the most challenging to get health insurance because they're young, they're healthy, they feel they don't need to spend money on health insurance, but yet they're the ones we need most in the risk pool, because if you don't have young, healthy folks in the risk pool, you're spending a lot more money on older, higher utilizers. So we want to balance that out. We've done incredible focused targeted outreach and marketing efforts to really reach that population. And the young adult subsidy is another tool in our toolbox that has really helped us increase that. So by providing, on average, it's about $30 a month for young folks, and by young, I mean between ages 18 and 34, and it graduates based on income and age of what they would get, but it has been very successful to help us get those younger folks in. As of January 31st of this year, we saw the growth in young adult enrollment was increased 11% year over year, and that outperformed growth in all of our enrollment ages, which was 8% year over year. This was the largest such increase of young adult growth, enrollment growth in 4 years. Our young adults comprise more than 24% of our total new enrollees compared to 4% the year before. And as of December of 22, young adults were less likely to drop coverage compared to the prior year when the subsidy was not in effect. In effect, the number of young adults who dropped coverage fell 3%, although among all of our enrollees, it had dropped by 9% compared to all enrollees. So that was a good indicator. The other area we found that the young adult subsidy has really performed well is in helping to ensure more folks in our target populations. So we saw that the young enrollees that got the subsidy were more likely to be Hispanic, which was 14% in our young adult population, Black or African American 22%, and female 57%. So we really saw some good gains in some of our targeted populations. We are looking at whether to continue this. There is a bill out there to continue the subsidy program for another 2 years. And of course, this money is taken out of the reinsurance fund. The exchange supports continuing this program. Preliminary analysis shows that although our results are encouraging, we still want to see the impact when the public health emergency ends, and those folks that have been getting, especially in that age group, we expect about 22,000 of them. When they no longer can get free Medicaid coverage, ideally they'll be able to move into a very low cost plan on the exchange. So we want to still evaluate what that program will do after the public health emergency ends. And also right now through the federal government, we have enhanced tax credits that were afforded through ARPA and now have continued on through 2025. That also is helping drive down those costs, but we want to see again, absent that, how this subsidy might help in the long term. So we do want it to continue, and we'll see what happens with legislation. With that, I will end, and if there's any questions for myself or Tony, we're happy to answer.
Thank you, Madam Director. And I do think that you answered my questions in reference to that segment population that you were talking about. Seeing no questions, just want to thank you for your leadership. Thank you for your service. Thank you for your team. And Ms. Smith, as always, thank you for the comprehensive report.
Thank you.
Yes, ma'am. Colleagues, at this time, we'll bring up Ms. Kamoro for the MDH Public Health Administration analysis.
Okay, thank you, Mr. Chairman. My name is Naomi Camaro. I'm here with DLS, and I'm going to present the fiscal 24 allowance for the Public Health Administration. Oops, apologies. On this first page, you can see that the total budget for PHA has decreased 6.9% to $262.4 million. On the next page, you can see that the 24 allowance includes 2 proposed efficiency appropriations under the fiscal 23 working appropriation. The first is $200,000 for a workforce development data system, and then the second is $115,000 for the income tax preceptor program for medical professionals. Page 3, Exhibit 1 shows the breakout of the fiscal 24 allowance, and you can see that about 44% of the budget is allocated to core public health funding for local health departments, and about 21% of the budget is allocated to personnel, the largest share taken up by the Laboratories Administration and the Office of the Chief Medical Examiner. And then just over 10% of the budget is allocated to each the Office of Preparedness and Response and the Laboratories Administration. Page 4, Exhibit 2 shows the line item changes of the fiscal 24 allowance. And as I said earlier, the total budget decreases by 6.9% or about $19.5 million. I'm just going to go through a couple of these line items. Most of the change is due to the expiration of federal funding. And so on page 5, toward the top of the page, you can see that there's a decrease of $4.2 million due to the expiration of overdose data to action grants, which are awarded by the CDC for data collection and analysis efforts in response to the opioid epidemic. And then further down along this page, you can see a decrease of about $26 million due to the expiration of American Rescue Plan Act funding meant to support preparedness activities. I'm going to skip to page 7 and look at personnel over the last few years. As of December 31st, 2022, PHA had 80.5 vacancies, or a vacancy rate of 18.47%. And this is 37 positions over the budgeted turnover. The highest amount of vacancies are in the Office of the Chief Medical Examiner and the labs. And these are also the offices with the highest amount of employees. So this is related to the issue that I'm going to discuss today, which starts on page 8, related to the Office of the Chief Medical Examiner. In recent years, due to the COVID-19 pandemic and the opioid epidemic, cases have been rising for the office. In addition, the office has had some challenges with recruitment, in part due to a shortage of medical examiners that's been felt across the country. On page 9, Exhibit 4 shows the number of deaths investigated and autopsies performed over the last 10 fiscal years. And you can see that it's been increasing. And since fiscal 2020, the percent of cases examined within 24 hours has been decreasing. And this is exacerbated by the staffing shortages as well. This also leads to a high autopsy to medical examiner caseload ratio, which is an issue for several reasons. One of which is that it threatens the accreditation status of the office. The National Association of Medical Examiners, or NAME, inspects medical examiner offices and issues accreditation to the offices that meet certain criteria. And one of them is related to staffing. On page 10, Exhibit 5 shows the autopsy caseload to medical examiner ratio over the last 10 fiscal years. That black line shows the maximum amount allowed by NAME for full accreditation status, which is 325 autopsies per medical examiner per year. And since fiscal 21, you can see that OCME has surpassed that ratio. During COVID-19, NAME waived that requirement. And so OCME has been able to establish full accreditation status despite exceeding that ratio. But that grace period ended January 1st of this year, and the office's accreditation status expires in May, so it will need to address the caseload issue. The 2022 Joint Chairman's Report requested a report from MDH on retention and recruitment efforts taken by the office. And the fiscal 23 budget bill restricted $500,000 in general fund appropriation pending submission of this report. MDH submitted this report in January, and so the Department of Legislative Services recommends releasing this funding, and will process a letter to that effect if no objections are raised by the subcommittee. Exhibit 6 on page 11 further illustrates the vacancy issues. It shows the number of vacancies and filled positions in the last 5 fiscal years. And it also shows that the proportion of positions filled by the office has been decreasing during this period. And as of January 1st of this year, the office had about 78% of its positions filled. I'm going to skip now right to the end, to the recommendations on page 16. The first of which is to restrict $250,000 of general fund appropriation upon submission of a report related to public health workforce staffing. This was a report that was requested in the 2022 JCR, and MDH as of yet has not yet turned in this report. And so we recommend restricting that funding again this year. The second recommendation is adopting committee narrative, requesting a report on the Office of the Chief Medical Examiner's accreditation status. And then finally, requesting a report on an update on the Public Health Services Data Modernization Project, which is a new project that PHA is undertaking and has submitted to do it as of October, but we don't have many details on it. And with that, I'll conclude my presentation. Pass it back to you.
Thank you, Ms. Kamaro. Seeing no questions by none of the committee members, I'd like to bring up Madam Deputy Secretary.
Good afternoon, Mr. Chairman, members of the committee. Thank you so much for having the Department of Health here and Public Health Services. For the record, my name is Dr. Jinlene Chan. I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. The Secretary, Laura Herrera Scott, could not be here today as she was asked to join the governor at an event, but she sends her kind regards and is sorry to not be here today with you. I am joined, however, today by Emily Brandenburg, our Chief Financial Officer, as well as David Davis, who is available for questions, and Webster, he is our Director of Budget and Finance, and Webster Yee, the Assistant Secretary for Health Policy. So again, thank you so much for having us here to respond to the questions regarding the budget for public health services. Thank you to Ms. Kamuro, not only for her detailed analysis and presentation, but also in the last few months as she has come on board, actually really engaging with us and local health departments to really understand our work. So we appreciate her time spent with us. We have provided a more detailed written analysis, so I will mainly touch on the highlights. In regards to the Office of the Chief Medical Examiner, over the last year, there have been continued efforts to increase our staffing, including adding additional medical examiners. There were 2 that started over the summer and have been working with us. We also have implemented both retention and recruitment bonuses last year and again this year. And we are now currently working with the Postmortem Examiners Commission on a proposal that we're hoping to finalize that would provide additional support for our medical examiners. In regards to the Office of the Chief Medical Examiner report on staffing that was submitted, we concur with Ms. Kamaro's recommendation to release the funds, and we appreciate the legislature's support on that. We are continuing our conversations. Also, there was a separate report regarding working with the University of Maryland, and so those discussions are continuing in terms of how both the University of Maryland's Office of Graduate Medical Education, as well as in other institutions, how we may be able to collaborate further with them to further increase trainees coming into the field of forensic pathology. The OCME continues to be dedicated to serving Maryland families. Again, you know, the OCME intersects with families at what is really the most challenging times of their lives when they have lost a loved one. And so, you know, because of their work over the last year, I am happy to report that there has not been any autopsy backlogs since last year. And again, I thank the dedicated staff at the office for all of their work over the last year. In regards to the name accreditation, the office has already begun work on preparing for the accreditation visit from name, which is anticipated for later this year, though it has not been set. The department appreciates the support and continued interest of the legislature in the work of the Office of the Chief Medical Examiner. I'd like to now turn to discuss one of our top priorities, and I know that this is one of the top priorities as well for the governor as well as the secretary with regards to public health infrastructure and strengthening that across the state, including at local health departments. And for us, that includes staffing as well as data modernization, training, increasing the number of individuals who are hired, and addressing our vacancy rates. With the COVID pandemic, that of course shone a bright light on the work of public health. But the reality is that our public health workforce and the services that we provide are critical every day, not just in emergencies, to protect the health and lives of Marylanders. The department is committed to filling these vacancies around the state, working very closely with our local health partners, as well as other state agencies and other ways that we can recruit and attract qualified, dedicated people to work with us. With regards to public health data modernization, that is a critical component of the modernizing our overall public health infrastructure for the future here in the state. As the pandemic has demonstrated, having updated, integrated data systems and tools are really necessary to inform all of our public health practitioners across the state to prioritize and focus our resources to address needs and disparities that we face across a myriad of health outcomes that we're all working towards to improve. We concur with the recommendation to provide additional detail about our work on the Public Health Data Modernization Initiative as it moves forward. So with that, Mr. Chairman, members of the committee, that concludes my remarks in response to the budget analyst, and we are happy to answer any questions.
Thank you. Two very quick questions. One of them was, help me understand the rationale for the later date for the later date for the report to be submitted, the December 15th versus November 1st.
We are looking to make sure that we have that discussion with our other colleagues with the Department of Budget Management as well.
The second one on page 11 of Ms. Camaro's analysis, she referenced February 2nd that you all had a candidate for the chief medical examiner. Just wanted to understand quickly, how was that going?
So the Postmortem Examiners Commission has been interviewing a number of candidates and is still considering various candidates for that position. It's a really critical one, so we continue to move forward. We understand, and I have conversations with the chair fairly frequently to make sure that we are moving forward to make the appropriate appointment.
Yes, ma'am. Madam Deputy Secretary, I just want to say thank you and Dr. Scott for your leadership for what you do for the state of Maryland. Ms. Camaro, thank you as usual. In reference to comprehensive reports, colleagues, this ends Maryland MDH Public Health Administration, and now we'll be moving on to Ms. Ann Wagner with MDH Prevention and Health Promotion Administration. I apologize. We have one public testimony. Mr. Eric from Alzheimer's Association. Did he make a mistake? Sign up with the wrong one?
Maybe.
You wanted the next one?
Yeah.
Thank you. All right, Ms. Wagner.
Thank you. It actually gives me a little more time to set this up. So. Great. Thank you very much, Mr. Chairman and members of the committee. Today, I'm presenting the operating budget analysis for the Prevention and Health Promotion Administration. This is the largest office under MDH's Public Health Services Administration, and it coordinates activities like infectious disease and chronic disease prevention, environmental health monitoring, and maternal and child health improvement. The fiscal 24 allowance decreases by $45 million to just under $600 million in total funds, and that is predominantly supported with federal and special funds. The overall decrease in spending is driven by the end of one-time COVID-19 federal funds. However, on the next page, looking at the Exhibit 1, this shows that other costs not related to the COVID-19 federal spending is actually increasing. So I'm going to jump ahead to the performance analysis section. Exhibit 2 shows recent trends in cigarette use among adults, high school students, and middle school students, with cigarette use generally decreasing for each age group. FIPA set certain goals for declines in cigarette use compared to certain selected baseline years, and most recently those goals were met across all age groups. Exhibit 3 on page 6 of the analysis specifically looks at e-cigarette and other electronic smoking device use among youth, showing a large decline among high school students most recently, although electronic smoking device use continued to be much more prevalent, with 15% of high school students reporting that they use ESDs compared to less than 5% of high schoolers reporting that they smoked cigarettes. The next page discusses how Maryland has invested state funding from the Cigarette Restitution Fund for tobacco use prevention and cessation since the fund was first established in 1999. The use of this funding has expanded over time and has consistently aligned with best practices published by the CDC. Most recently, 2021 legislation required that at least $18.25 million across all funds support tobacco prevention activities. And in fiscal 23, the additional funds supported local health department tobacco control programs and media contracts for tobacco prevention, among other uses listed on this page. Activities specifically targeting ESD or e-cigarette use may be an appropriate use of the additional funding for tobacco prevention. And MDH is asked to discuss how current tobacco use prevention and cessation activities target e-cigarettes and electronic smoking devices and how best practices are being incorporated. Moving on to a discussion on the new Cannabis Public Health Fund. This was created as part of 2022 legislation that was contingent on the referendum to legalize adult use cannabis. The uses of this fund are outlined on page 9 of this analysis. Eventually, the fund will be supported with revenue from adult use cannabis, but in the fiscal 23 budget bill, there was a one-time restriction of $5 million from the rainy day fund to establish the fund. The governor announced on January 19th, 2023, that the $5 million from the rainy day fund would be released in fiscal 23. The CDC has published some best practices for monitoring cannabis use and any related health effects. And it's also expected that FIPA's Managing for Results performance measures would expand to track the prevalence of cannabis use alongside the measures that were just discussed related to tobacco and e-cigarette or electronic smoking device use. And so on the next page, FIPA is asked to comment on how it will spend the $5 million for the Cannabis Public Health Fund in fiscal 23 and beyond, how it will incorporate CDC best practices to respond to public health impacts of adult use cannabis, and then what kinds of performance measures related to cannabis use will be added into the annual MFR submission, including the timing of when those measures will be added. So then I'll turn to the budget discussion. Exhibit 4 on page 10 shows the decline from fiscal 22 actual spending to the fiscal 24 allowance in one-time COVID-19 federal funds. Supplemental funding through the CDC's Epidemiology and Lab Capacity Cooperative Agreement was the largest source of COVID funding under FIPA. These funds were authorized in multiple installments throughout the various federal stimulus bills, but they generally supported many different COVID response activities. The American Rescue Plan Act also authorized $182 million through this same program, but it was targeted for short-term uses like COVID-19 testing, supplies, and personnel costs, specifically to assist schools as they return to in-person learning. In fiscal 24, some of the budgeted funds account for underspending of CARES Act funding from fiscal 22. And so some of that funding did receive extensions beyond the original grant expiration date. And so FIPA is asked to provide an update on any unspent COVID-19 federal funds, and then to clarify the current expiration dates for the supplemental epidemiology and lab capacity grants. Then I'll move on to Exhibit 6. This chart shows an itemized list of changes from the working appropriation to the allowance. As was just discussed, the overall decrease in this budget is driven by a $61 million reduction in COVID federal support. This decrease is offset partially by a few new initiatives that are highlighted below on this list. I'll scroll a little bit. So first, to discuss the abortion care clinical training program and special fund, Chapter 56 passed last year, created this program and required that $3.5 million be appropriated to a newly established special fund annually. Language in last year's budget bill restricted $3.5 million from the rainy day fund to be transferred to this fund. And again, the governor announced on January 19th of this year that the funding would be released in fiscal 23. The fiscal 24 allowance includes $3.5 million in general funds to be paid into the abortion care clinical training program fund. And then it also reflects $3.5 million in special funds to account for the special fund expenditures. The second item I'll highlight is the Pediatric Cancer Fund, which was established through legislation last year to distribute research grants. A supplemental budget from last year authorized the transfer of $5 million from the dedicated purpose account to the Office of the Secretary for this fund in fiscal 23. And so though not required by the bills from last year, the fiscal 24 allowance provides an additional $5 million budgeted to the fund under FIPA. And so this is appearing as a $5 million increase in the FIPA allowance. I'll move ahead to a short discussion on the Maryland Prenatal and Infant Care Grant Program. This program provides grants to increase access to prenatal care services and care coordination services for low-income pregnant and postpartum women, and then also young children. 2021 legislation required that this program receive increasing mandated funding levels, but the allowance is level funded at $1.1 million and does not reach the $2.1 million mandate for fiscal 24. And so MDH is asked to comment on why the mandated funding level was not provided in the allowance. And DLS recommends that MDH work with the Department of Budget and Management to add funds through a supplemental budget to meet the required $2.1 million funding level. Moving on to personnel trends, as of December 31st of 2022, FIPA reported a vacancy rate of 13%, which was almost 2 percentage points higher than the vacancy rate in December of 2021. MDH has reported persistent vacancies among public health staff, and committee narrative and budget language in the past 2 years requested reports on public health recruitment and retention that have not been submitted. This was also discussed in the analysis just now on public health administration. MDH is asked to explain why public health vacancy rates have worsened over the past year and to provide an update on when the requested staffing reports will be submitted. So then moving on to the issues discussion, that starts on page 18. This first issue relates to school-based health centers that offer primary care, preventive services, and behavioral health services in schools or on school campuses. Effective July 1st of 2022, grant administration for Maryland's 95 school-based health centers transitioned from the Maryland State Department of Education to MDH as required by 2021 legislation. And then also starting in fiscal 23, the Blueprint for Maryland's Future provided $6.5 million in additional support for school-based health center grants each year. In the first year administering the grant program, MDH is spending most of the program budget for operational grants to existing school-based health centers and using the remaining funds to conduct a needs assessment, provide technical assistance, and invest in one-time infrastructure needs for school-based health centers. Language in last year's budget bill requested that MDH prepare a report on the ability of school-based health centers to claim Medicaid reimbursement for the health services they provide. And so turning to Exhibit 7, MDH found that only 19%, or about 8,300 health center visits, were reimbursed by Medicaid from calendar 2017 to 2019. The report also found that fewer than half of school-based health centers billed for Medicaid, with 3 centers providing about 75% of the Medicaid reimbursed visits. MDH described a few different barriers to preventing school-based health centers from claiming Medicaid. That includes not having access to the family's insurance information, sponsoring organizations for the school-based health centers not having the billing infrastructure needed to claim Medicaid funds, and then confidentiality concerns related to Medicaid requirements that families be notified when a claim is denied. To encourage more Medicaid claiming, MDH is working to involve more sponsoring organizations that already have the necessary billing infrastructure. And the department is also working with a vendor, or is planning to work with a vendor on a strategy for school-based health centers and sponsoring organizations to improve their billing supports, and eventually hope to integrate school-based health center IT systems with CRISP to improve access to Medicaid eligibility and enrollment data. MDH is asked to provide an update on these efforts to expand Medicaid claiming at school-based health centers, and DLS recommends adopting narrative, requesting another report on Medicaid claims in the health centers. Moving on to the second issue, this has to do with the Maryland AIDS Drug Assistance Program. In Maryland, using federal and state funding, FIPA provides healthcare and support services for people living with HIV and AIDS, including purchasing their necessary medications. For medications purchased above a certain federally set price, Maryland receives rebates that show up in the budget as special funds, and they can be used on a variety of healthcare and supportive services that were listed on the top of page 22. Exhibit 8 shows recent spending trends of these rebates, showing that FIPA has kept a closing balance of over $50 million in each year, and that's due to underspending its annual rebate appropriation. Most of this funding is distributed to local health departments and community-based organizations for HIV and AIDS services, and recent workforce shortages have limited in partnering programs from spending all of their grant awards, and so that contributes to the underspending. In recent years, the COVID-19 pandemic also led programs to temporarily close, and for utilization of HIV and AIDS health services, their utilization to drop, as was seen in other healthcare settings, and so that also led to some of the underspending. MDH is asked to provide recent MADAP rebate expenditures and to discuss how it is working on spending down the $50 million special fund balance that was reported at the end of fiscal 22. The allowance also includes continued funding for a major IT project that would support the MADAP program's case management system. While $2 million in the rebates supported the project in fiscal 23, the project receives $2.3 million all in general funds in fiscal 24. And so these general funds are budgeted under the Department of Information Technology, but the analysis points out that FIPA's large special fund balance of rebates could support these costs instead. I'll very briefly go over the last issue that has to do with the federally funded WIC program. This program provides supplemental food and nutrition education to low-income pregnant and postpartum women, and then infants and children. Exhibit 9 shows recent trends in WIC participation, showing that all eligibility groups have seen declining participation in fiscal 22 and in the years prior to that. The analysis outlines quite a few program changes that have been implemented to encourage higher participation, like allowing WIC benefits to be paid at self-checkout stations and efforts to expand the authorized food list. And then there were also some other changes outlined that were made to continue operations during the COVID-19 pandemic. This included allowing Maryland WIC to defer in-person checks to determine participants' nutritional risks, in addition to a few other program changes. And so FIPA is asked to comment on which program changes related to the pandemic have been made ongoing or permanent. And lastly, the American Rescue Plan Act authorized a temporary expansion in certain fruit and vegetable benefits, and the Consolidated Appropriations Act that just passed in December of 22 extends this benefit through September 30th of 2023. And so in their budget testimony, MDH should clarify how much of the American Rescue Plan funding for this benefit had been or was expended. And on pages 27 and 28, this outlines DLS's recommended actions. The first two pieces of narrative relate to reports that were requested in last year's JCR that MDH has not yet submitted. And then the third item shows the recommended narrative related to Medicaid claiming in school-based health centers. And so with that, I will conclude the presentation. I'm happy to answer any questions.
Thank you, Ms. Wagner. Seeing no questions from members of the committee, I'd like to bring up Madam Deputy Secretary again. Madam Deputy Secretary, just reminding you that we do have your written testimony, and if we get kind of limited to the comments.
Yes,
Yes,
thank
ma'am.
you.
Thank you.
Thank you, Chair McCray. Again, members of the committee, my name is Dr. Janleen Chan. I'm the Deputy Secretary for Public Health Services with the Maryland Department of Health. I want to thank Ms. Wagner for her detailed analysis and presentation about the Prevention Health Promotion Administration's budget. I am joined by with Emily Brandenburg here, our Chief Financial Officer, and available for questions in the audience are Courtney McFadden, the Acting Director for Prevention Health Promotion, as well as David Davis, our Director for Budget and Finance for PHS, and Webster Yee, Assistant Secretary. So again, I will just focus on the highlights in response to Ms. Wagner's questions. So first, we were asked about the work that we are doing, incorporating some of the prevention activities related to electronic smoking devices among youth into our overall tobacco cessation activities. We have seen increases in the percentage of high school youth who have reported using ESDs, or again, the electronic smoking devices And now, as is noted, more youth use ESDs than smoke combustible tobacco. A number of the activities are listed in our written response in terms of how we have used the funding that we do have to focus on prevention of ESD use, including activities such as the vape experiment, which focuses on ESD use. We've also, in other activities that have been longstanding, such as our Maryland Quit Line, have actually integrated treatment and counseling programs specific to ESDs within those available resources, including resources targeted towards adolescents. Similarly, in our work related to the new Cannabis Public Health Fund, we will be building on those many years of experience and the foundational programs and activities that we have related to tobacco use prevention programs to focus then on preventing cannabis use among youth, including activities to educate and inform parents, educators, local health departments, and of course, our children and youth. We have been consulting very closely with the Maryland Medical Cannabis Commission on this work because of their subject matter expertise, and to also ensure alignment of our overall activities, including developing appropriate MFR metrics planned for FY 2025. In relation to the federal funds that support the enhancing laboratory capacity grants that we had related to the COVID pandemic, we have provided that information in our written response in terms of what is unspent to date. And in relation to the prenatal and infant care grant program, we are working with the Department of Budget and Management to ensure that it is fully funded in FY 24. In the analysis, we were asked to comment on the vacancy rates in PHPA. And again, I would emphasize that filling vacancies is absolutely our top priority for this administration and for the Department of Health and the Secretary. We have to have qualified people both at the state level and the local level to ensure that we can provide good, high quality services for Marylanders. So PHBA has experienced an increased turnover over the last few years related both to individuals retiring as well as resigning. And at the same time, we've expanded our efforts with recruitments, working very closely with our colleges and universities, including HBCUs, to look at pipelines and trying to encourage individuals to apply and come work for the Maryland Department of Health to serve Marylanders. As noted in our response, we do right now have 9 candidates that are lined up and are at various stages of onboarding. And so we're looking forward to having those and others join us. Turning to the school-based health centers, this program just this fiscal year transitioned from MSDE to the Maternal and Child Health Bureau within PHPA. The team has been working very closely with Medicaid actually since 2021 to ensure that our goals and the work are aligned to support school-based health centers across the state, including this assessment that was conducted last year that you have in your written response. The assessment identified some of the barriers that Ms. Wagner did note, and we are working right now to engage a vendor to help address some of those barriers individually with the sponsoring entities for each of the school-based health centers so that we can improve both billing and revenue cycle management so that we can enhance program funding streams, sustainability, and ultimately to enhance and expand the types of services and availability of services for Maryland children. We concur with the recommendation to submit a more detailed report as this work continues. Regarding the plan for the expenditures related to the Maryland AIDS Drug Assistance Program or the MADAP program, the department agrees that it is absolutely important that any funding that we have available be applied back into our communities to serve this very vulnerable population. And as such, we anticipate increased spending to expand the number of clinical and social supports providers across the state. We're looking to put out a grant of availability so that we can engage additional community organizations to serve Marylanders. And we're also working with local health departments and other existing providers to enhance workforce development as well as recruitment to fill those positions. Lastly, we were asked to comment on the changes to the WIC program that happened during the pandemic and what might happen after the end of the public health emergency. The USDA has actually been authorized to extend 2 of the waivers, specifically the physical presence. There had been previously a requirement for families to be physically on site to issue their benefits, and remote benefit issuance. Those 2 are able to be extended through September of 2026, and Maryland has opted into both of those to be able to better serve Maryland families. Also, the temporary enhanced fruit and vegetable benefit was for about 4 months in 2021. We received those dollars, and actually we issued about 95% of the 9 million or so that we received here in Maryland to expand the fruit and vegetable benefit. And so it was only for that 4-month period. And so Maryland families used about a little bit over 5 million of the benefits that were issued to them, and we were required to return the remainder. However, since then, beginning in October of 2021, that benefit has continued with the expanded fruit and vegetable benefit because it's actually incorporated within our regular WIC allotment. So with that, Mr. Chairman, that concludes my response, and we are happy to answer any questions.
Thank you, Madam Deputy Secretary. And seeing no questions from members of the committee, just want to say thank you again. It looks like it's our final time, but more importantly, look forward to seeing you more. And Ms. Wagner, thank you for the comprehensive analysis. Colleagues, this is our, yes, ma'am. Colleagues, this is our last one. We do have testimony. So the public testimony we'd like to bring up, Alzheimer's Association. All right. Eric, we were going to limit it to 2 minutes, so 2 minutes.
I'll do my best.
Yes, sir.
Mr. Chairman, members of the committee, for the record, Eric Colchmero with the Alzheimer's Association, here in gratitude for the work of the Maryland Department of Health, and with 2 requests for this committee. When it comes to Alzheimer's and dementia, the governor speaks about being in Maryland asset rich and strategy poor. On this disease, it's the other way around. We had a 2012 state plan on Alzheimer's and dementia. It was never implemented because there were never the assets in the Maryland Department of Health, never the dedicated budget to implement it. We now have a recently released 2022 state plan. There is no permanent funding for Alzheimer's and related dementia. So today we're here with a request to add $3.5 million to FIPA's budget for the Center for Chronic Disease Prevention and Control's Cognitive Health Program. In April 2022, thanks to the General Assembly and so many who personally understood why this disease matters, funds were added. It's going to important initiatives. It's going to these funds are going to the Asian American Center in Frederick for caregiver outreach and education. It's going to a Baltimore City brain health initiative to explore the prevalence of African Americans and Alzheimer's in the city. It's going to the Eastern Shore, MAC Inc. and their area agency, and Charles County. Jurisdictions throughout the state are getting their public health infrastructure as it relates to Alzheimer's built up. Yet in the summer of 2022, when the health department was developing its budget, despite the new requirement to have a director of dementia services and brain health, despite a new Alzheimer's state plan, they chose not to keep this money in their budget and not to strengthen the public health infrastructure for those with Alzheimer's and related dementia. And today we are here, the Alzheimer's Association is here to ask the health department to consider adding this funds in a supplemental or if not, for this committee to use its new authority to do so. Secondly, the governor, going back to this administration, recently today released an executive order about strengthening government accountability and reporting out on performance. We're asking for the same thing when it comes to Alzheimer's and dementia. So for this $3.5 million that was in the budget on a one-time basis, which we want to be permanent, we'd like to know where it's going. The health department has given a broad strokes overview in some public meetings. We are requesting budget narrative with details, explaining each awardee, amount received, project objectives, and project goals accomplished, and for this report to be due in the fourth quarter of 2023. The department developed its spending plan informed by the recent Alzheimer's state plan, yet its use of taxpayer dollars is not fully known externally. We thank you for your time. The Alzheimer's Association, again, is grateful for the career civil servants at the department and those who are doing such amazing work, but we are here with those requests today. Thank you.
Thank you, Mr. Colchamero. Colleagues, are there any questions? Seeing none, I'm going to move on to the next person with public testimony, and it looked like it's Mr. Kevin Cullen from the University of Maryland.
Chairman McCray, members of the subcommittee, Senator Zucker, nice to see you. Thank you very much for this opportunity to speak to you briefly, to express the appreciation on behalf of everyone at the University of Maryland, Marlene and Stuart Greenebaum Comprehensive Cancer Center for the ongoing support through the Cigarette Restitution Fund. The CRF has been part of a multifaceted state effort, which over the last few decades has made significant progress in reducing the burden for people throughout Maryland. In 1990, cancer mortality in Maryland was the highest of any state in the country. Today, through the CRF, through the efforts of our partners at the Department of Health, cancer mortality in Maryland has dropped to 32nd in the nation and is continuing to fall. So that's great progress we can all be proud of. With the CRF support, our center has grown, and we now currently serve approximately a quarter of all cancer patients in the state of Maryland. Cancer research funding with CRF support has increased to over $1 billion in total that we have received from external sources through the foundations that have been laid by CRF. And that funding has led to breakthrough treatments for breast cancer and other diseases. And it's enabled us to provide cutting-edge clinical research opportunities for patients throughout Maryland, including underrepresented minority patients in our catchment area. Currently, more than half of the patients who participate in clinical trials at the University of Maryland are underrepresented minorities, and we believe that's among the highest percentages in the nation. And it's part of critical efforts to improve health equity in the state. Very briefly, I'll finish with 3 highlights from the last year that reflect the importance of CRF. We were able to break ground on a brand new cancer tower, the Rosalind and Leonard Stoller Center, which will be the new home of the Cancer Center and will provide state-of-the-art treatment facilities for patients with complex malignancies for the generation to come. Our Baltimore City Cancer Program, funded by the CRF, has now passed 38,000 cancer screenings, diagnosed 190 cancers with a 93% survival rate for uninsured and underinsured people in Baltimore. And lastly, one thing that I'm particularly proud of is our efforts in education. One of the mandates of an NCI Cancer Center is to educate the next generation of scientists. 7 years ago now, we started the Cure Scholars Program, which very briefly was designed for middle school students in West Baltimore. We graduated our first class this past year, 17 kids with more than $1.5 million in scholarships, more than 100 college acceptances. And I close with photographs of 2 of our students, one of whom received a full scholarship at Spelman, another who received a full scholarship at Loyola. And it's part of our commitment to improving things for the people in West Baltimore. And with that, thank you very much. And I apologize, I ran slightly over.
No, just want to thank you. And I'm fully aware of like the work that's going over with the University of Maryland with the Career Scholars Program, and just thankful for that leadership too. So just wanted to acknowledge that.
Thank you.
Senator Zucker.
Well, thank you very much, Mr. Chairman. Dr. Cullen and I have a long-standing friendship, but recently it's come to our attention that Dr. Cullen is going to be stepping down as director, but he'll continue, I understand, practicing. But Dr. Cullen, we just all wanted to salute you and thank you because you and your team, because I know nothing could be done alone, but you and your team have saved countless lives, offered guidance, and I know you'll continue contributing to the state, but and you'll be back, maybe not in the same capacity, but we just wanted to all thank you for your countless years of service and helping to make Maryland a more healthy place to live and raise a family.
Thank you, Senator Zucker. Thank you for the kind thoughts.
Seeing no more comments, colleagues, I also wanted to acknowledge that both Mr. Colchomero and Dr. Cullen both submitted testimony in our packets. This ends. Okay, William Nelson.
Thank you, Chairman McCray and committee sub. We almost always tag team every year, Kevin and I want to join Senator Zucker and commending Kevin Cullen for his wonderful stewardship of the Greenbaum Cancer Center for many years. We're blessed to have 2 NCI designated cancer centers in Maryland, and we're also blessed to have a legislature and a Department of Health interested in supporting cancer research and improving the cancer outcomes in Maryland through the Cigarette Restitution Fund. We invest these funds in 3 principal areas. One is recruiting the most talented and, believe me, ever more diverse collection of young people from across the country, bringing them here to Maryland, launching them on our faculty in our cancer center, and watching them impact cancer outcomes moving in the future. We focus on research projects of cancer problems of interest to people in Maryland, things like the new immunotherapies for cancers and using DNA diagnostics, increasingly poised to transform cancer diagnosis and detection, and also cancer treatment monitoring. And then we also launch companies to make sure these technologies are available and bring economic activity into the state. One of the companies, Delphi Diagnostics, last year announced a $225 million Series B fundraising founded by Victor Valkulescu, initially a number of years ago, a beneficiary of Cigarette Restitution Fund changes. The thing I'd like to tell you moving forward is we're beginning to build more and more, my partner in crime back here, Otis Brawley, our associate director, more and more in the implementation science and outreaching in the community, not just in the city of Baltimore, but throughout the state, Western Maryland, Southern Maryland, and the like, with cancer education, empowering and educating Marylanders so they can reduce their risk for cancer. And if they were to have cancer, they know where to turn and where to go. So with this, it's wonderful to be in a state that invests its resources in improving cancer outcomes. And as Dr. Cullen said, it's working. So thank you very much.
And thank you, colleagues. I'm very sure that this ended the public testimony. Ms. Wagner, just thank you again. At this time, I'd like to bring up Mr. Samuel Quist for DHS, Office of Home Energy, to give out the analysis.
All right, thank you, members of the subcommittee. My name is Samuel Quist from DLS. This is the budget of the Department of Human Services Office of Home Energy Programs. The FY24 allowance is $215.4 million, which is approximately a decrease of $8.8 million from the FY23 working appropriation. And this decrease primarily results from changes to federal funds, including one-time and limited time federal stimulus funds for energy assistance, which are partially offset by increases in special fund revenues from the Strategic Energy Investment Fund allocated for energy assistance. I'm going to turn now to Exhibit 1 on page 5 of the document. This is providing some historical information. The top line in this chart is total applications for energy assistance. As you can see, there has been some fluctuation in recent fiscal years in FY 20 and 21 related to the pandemic. There was a moratorium on utility terminations that was in effect during calendar 2020, which resulted in lower numbers of applications. And then in 2021, you see a corresponding increase following the resumption of collection activities related to utility arrearages. In FY 22, there's a pretty substantial decrease. And then this chart ends at FY 22, but then in FY 23, you're seeing a pretty substantial increase once again related to in FY 23, rising energy costs and some other factors. The other lines on this chart summarize the number of households receiving benefits for the main 4 programs that DHS offers. As you can see, for the two bill pay assistance programs, which are the second and third lines from the top, these have generally been declining in recent years. The green line, second from the bottom, is the EUSP arrearage assistance program, which has increased in the past 2 consecutive fiscal years. Turning to the second exhibit, which begins on page 6, this is showing data on assistance applications and benefit data for the current fiscal year, FY 23 through December, and then comparing that to the same time period in FY 22. So as I mentioned, in the applications section on the top portion of this chart, you can see this pretty substantial increase in total applications filed over the first half of the fiscal year, about 29 and 32% for the 2 bill pay assistance, higher compared to FY 22 during this time period, and then 63 and 76 for the 2 arrearage assistance programs. I would point out that there are a couple of factors impacting applications. The first is inflation, and specifically inflation in the energy sector. We're all aware that there have been rising gas prices, rising other energy costs. And as reported by the U.S. Energy Information Agency within the U.S. Department of Energy, the U.S. residential price for electricity increased by almost 20% between January and September of last year. And the residential price for natural gas saw similar increases, increasing by about 23% higher at its height in August of 2022 compared to August of the previous year. Although this inflation has started to slow during the fall and the end of the fiscal year, demand for energy assistance this winter has also been impacted by the weather. There's been a generally colder than average temperatures this winter, and across the United States, you've been seeing that there's been some more severe winter weather occurring, and that also impacts energy assistance demand in a given year, depending on that, as it causes a higher amount of heating during the winter to be necessary. The second section of this chart that's shown is the number of households receiving benefits. And in FY 23 year to date, there's also a corresponding increase in the number of recipients, about 9% and 11% for the 2 bill pay assistance. And in the arrearage programs, it's even more significant, about 62% and 99%. In the gas arrearage, almost double for gas assistance. Then I'm going to pull this down to show the remainder of this section on the screen. The bottom half of this exhibit on page 7 This is showing data on average benefit size and then the total amount of spending in the budget on energy assistance benefits. You can see there's also notable increases in average benefit size, specifically for the EUSP programs. The EUSP bill assistance payment average benefit size has increased by about 26% from $742 to $939. There also have been increases in the two arrearage assistance payments. And if you actually do a 2-year comparison between December of 2020 and December of 2022, the increase is even more substantial for the two bill payment assistance. For the Maryland Energy Assistance Payment Program for heating assistance, the average benefit size has increased during that time period from about $471 to $939. And for the EUSP bill payment program, the increase was from about $510 to $849. If you look historically at the average benefit amounts, the average benefit amounts had never exceeded $800 for either of these programs prior to fiscal 2022. So in FY23 year to date, as a result of the rising average benefit sizes and the average number of households receiving benefits, you can see at the bottom of this chart, the total number of dollars paid out in assistance has grown. In FY23 year to date, it's about 26.2 million in total higher. This increased amount of dollars is supported through the continued availability of supplemental federal low-income home energy assistance program funds in the budget in FY23, as well as the growth in the special funds from the Strategic Energy Investment Fund. For the interest of time, I'm going to turn to exhibit number 6 on page number 14, which is showing the overview of the funds included in the FY24 budget. As I mentioned previously, the overall allowance totals $215.4 million, and the majority, about 94% of that budget, goes directly to energy assistance benefits. The largest being the EUSP program, which provides both electric bill payment assistance and arrearage assistance for electricity. This program is funded through a combination of sources, the largest two being the EUSP ratepayer surcharge, which totals $30.7 million in the FY24 budget, and the Strategic Energy Investment Fund special funds, which total $99.1 million. Then the second main component of this funding is the Maryland Energy Assistance Program. There is $69 million budgeted for that, primarily through federal low-income home energy assistance program funds to Maryland. The other smaller category of funding that I'd like to point out is that as part of the other category shown on this chart, there's $3.6 million in federal low-income water assistance program funds budgeted in FY24. Outside of the energy assistance portion of the budget, there is 5% of the budget, or $11.2 million, which funds contracts with local administering agencies for the administration of these programs. The analysis points out that the level of funding in FY24 is consistent with the level of FY23 funding. However, there is a plan that DHS has made to create a centralized administrative model for energy assistance by moving those to the jurisdiction of the local departments of social services as part of efforts to implement categorical eligibility with the other benefit programs that DHS oversees. As a result of this centralized administrative model, it's anticipated that in the future there will be some administrative cost savings. However, the same amount of funds is budgeted in FY24. So in the analysis, DLS asks DHS to comment on this in light of estimations for administrative cost savings in future years. And exhibit number 7 on pages 15 and 16 is showing the line item breakdown of the budgetary increases. I mentioned this a little bit earlier, but the main increase is 16.3 million in special funds from the Strategic Energy Investment Fund for energy assistance. These are funds that the state of Maryland receives as part of its participation in the Regional Greenhouse Gas Initiative program and result from the auctions that program conducts quarterly related to allowances for carbon dioxide emissions as part of the cap and trade component of that program. In state statute, about 50% of these revenues are allocated to DHS for energy assistance. And as a result of overall increase in revenue from that program to the state, the energy assistance portion is showing similar proportional increases as other programs funded through the Maryland Energy Administration. I mentioned the decreases in federal funds. The second, third, and fourth lines from the bottom of this chart are breaking these out. The largest is one-time supplemental federal LIHEAP program funds that are allocated in FY23. These come from both the Infrastructure Investment and Jobs Act, as well as a portion that was included in the continuing resolution passed by Congress last fall as part of the federal budget process. There is 3.4 million that is decreasing related to the low-income household water assistance program, reflecting the availability of funds from FY23 to FY24. And then there's also a smaller amount of funds, about 570,000, that is decreasing that were included in the FY23 budget from the State Fiscal Recovery Fund. The next section of the analysis and starting with Exhibit 8, this provides some additional discussion on the Regional Greenhouse Gas Initiative revenues from the CEF. Exhibit 8 is showing a summary of both quarterly auction results of revenue available to Maryland, as well as the quarterly auction price for the emission of the carbon dioxide emissions allowance. This will be covered more in depth in the Maryland Energy Administration budget hearing and their analysis, but this is basically showing that there's been a pretty substantial increase over the past couple of years related to revenue flowing to the state for the Strategic Energy Investment Fund for various purposes. And then Exhibit 9 is specifically showing the component of that for energy assistance included in the DHS budget. You can see in the FY23 working appropriation and the FY24 allowance. Both of these amounts are pretty substantially higher than in recent fiscal years. The FY23 working appropriation grew by over $50 million to $82.8 million from this fund source, and then continued growth in FY24 to the $99.1 million that I mentioned previously. Then the two issues that are discussed in the analysis, the first, Exhibit 10, this begins on pages 21 and 22 relating to application denial rates. Exhibit 10 is showing that there's been some fluctuation in recent fiscal years, specifically related to the gas arrearage assistance program. These are smaller programs overall related to in the context of the number of recipients. However, they have both generally higher denial rates, about 53% and 66% overall. The denial rates in FY23 to date for the two bill pay assistant program were 22 and 23%. This is also shown on page exhibit number 11 on the next page for the FY23 year-to-date application denial rates, as well as summarizing the most common reasons for denial, which, as you can see, incomplete information was the most common reason for application denial. There has been a policy change, I should mention, related to this, Chapter 638 and 639, which implemented a number of policy changes during the 21 session for energy assistance. Relating here, this allowed for the a couple month period following application denial for incomplete information to allow applicants to reach out to cure applications by providing additional information. DHS reported that over 51,000 applications were subsequently cured during fiscal 2022 as part of this process. The next two exhibits in the analysis relate to application processing times. The first exhibit number 12 is summarizing the number of days for overall. Looks like this doesn't all fit on the screen, but I'm going to scroll down to the bottom. The bottom line of this chart, the statewide average was 28 days during the first half of fiscal 2023, which was a slight increase of about 2 days from the full year 2022 average of 26 days. There was some variation depending on jurisdiction. There were a total of 14 local administering agencies which saw increases since FY 2022. There were also 6 that saw decreases. However, the largest increase since the end of FY 22 occurred in both Prince George's and Montgomery counties, with also Washington and Southern Maryland also seeing some increases. Exhibit number 3 is showing similar data related to processing times. This is the percentage of applications processed beyond the 55-day guideline. Although there are no concrete processing standards in statute, the 55-day guideline for basically for providing a moratorium on utility termination while an application is pending is typically used. You can see from this chart that the overall, the statewide was 13% processed in greater than 55 days during the first half of fiscal 2023, with the highest percentage beyond 55 days occurring in Montgomery County, followed by Prince George's County, Washington, Allegheny, and Southern Maryland. And the bold language on the bottom of page 25 in the analysis, DLS is asking the department specifically to comment on some of the factors causing these increases, and specifically discussing Montgomery, Prince George's counties, as well as Washington and the Southern Maryland Tri-County Community Action Committee, which serves the counties in Southern Maryland. The third issue that's discussed in the analysis on page number 27 is discussion of the low-income water assistance program. This was a program that was created through the federal stimulus legislation during June 2022. The Department of Human Services, or the U.S. Department of Health and Human Services, announced a $14.1 million total allocation to the Department of Human Services in order to fund this program, which is the first federal program that has been created specifically to provide assistance to low-income households in the area of water assistance. The $14.1 million total remains available in spending through the end of federal fiscal 2023. And as I mentioned, the $3.6 million that's budgeted in FY24 is the estimated remainder of unspent funds that will be available following the conclusion of the current fiscal year. As far as benefits provided under this program, the benefits vary, ranging between $100 and $2,000, and are one-time only payable to utility companies, similar to other energy assistance benefits. The analysis asks, DHS to comment on a couple of items in relation to this program. The first is that, as I mentioned, the 14.1 million allocated to the state was a one-time federal allocation. And as of current date, it is unknown yet if Congress is going to allocate additional funding for this program later on. So as it stands currently, once the funds budgeted in FY24 are exhausted, there aren't currently additional funds allocated for this program. So the analysis asks the department to comment on first how it plans to spend the remaining funds available before the federal expenditure deadline, and then after that deadline passes, how it will continue to support low-income households in Maryland in the area of water need. The other area that the analysis asks the department to comment on is how it is collaborating with the Department of Housing and Community Development. DHCD also received an allocation of federal funding from the American Rescue Plan in FY23 to oversee a water assistance program. And DLS is asking the department to comment on how work is being done with DHCD to prevent duplication in those two programs. I'm going to conclude by going over the two recommended actions that DLS is making in the analysis. These are both recommended actions related to committee narrative. The first recommendation on page 29 is requesting committee narrative similar to in prior years on application processing times and denial rates, as well as the denial rate data providing the common reasons for denial, which the department has provided to the General Assembly last year and in prior years. And then the second recommendation is related to the implementation of categorical eligibility. The department provided a report on this topic this interim. This is asking for a similar update at the end of fiscal 2023. As I mentioned, with the establishment of the centralized administrative model for energy assistance, as a part of the initiative to implement categorical eligibility, there are also a couple of other components that this report is asking for update on, including the centralization in the MD Think system of the data management system for OHEP benefits, as well as some of the statutory changes that would need to go into effect. I'm going to conclude the presentation there, and I can take any questions at that time. I believe that's all. Thank you.
Thank you very much, Mr. Quest. Well done, thorough analysis. It was so thorough, there's no questions. And with that, I'm just going to turn it over to the agency. Mr. Secretary, always great seeing you. And sir, I'll just follow your lead. However you want to start, please. Thank you.
All righty. Good afternoon, Acting Chair Zucker and members of the committee. I can relate. My name is Rafael Lopez and I'm serving as the Acting Secretary of the Department of Human Services. Thank you for this opportunity to discuss our Office of Home Energy Programs budget for fiscal year 2024. Joining me at the table to my left is Lashera Ayala, who's the Executive Director of the Family Investment Administration, which oversees our OHEP office. And to my right, Stafford Chipungo, our Chief Financial Officer. We also have available to answer any of your questions a series of leaders from throughout the department, including Daniel Waite, Acting Deputy Secretary for Administration, Marie McClendon, FIA's Deputy Executive for Operations, Augustin Natabagana Yama, FIA's Deputy Executive for Programs, Kate Natafaji, Acting Director for the Office of Home Energy Program, and Courtney Thomas Winterberg, Director of Allegheny County's Department of Social Services, who also serves as the Chair of the Maryland Association of Social Services Directors. And we're all here to answer your questions. I already gave Sam my gentleman's heads up that I'm deeply disappointed in his unthoughtful and uncomprehensive analysis. And, I'm just tired of it at this point. So for a random act of kindness day, I wanted to bring some levity and embarrass Sam just a little bit. But thank you, Sam. We appreciate it. So top of mind for me, obviously, are the 1 million Mariners we serve. And as I listen to this presentation now for the second time, really want to sort of begin by saying that after I met several of our advocates, I'm setting a new tone around partnering with our advocacy community to turn those numbers around a year from now. How might we use data to share it much more thoughtfully and more comprehensively? None of this information is secret. We've made a commitment already to our advocate partners as well as our staff that we're going to use the OHEP program and the availability of this rich data, put it on our website so that people can actually see it, and then help us answer the question, how might we engage more people to make sure people aren't turned away or that the application rate, denial rate isn't so high. So there's lots of things we intend to do in the next couple of months. So first, let's turn our attention to the recommended actions and issues. Simply put, we concur with the 2 recommended actions. We're going to follow up with a report on energy assistance, application times, and denial rates. I just talked quickly about how we intend to do that in partnership with our advocacy community and really center the voice of users here. Secondly, we'll provide updates on the status of the implementation of categorical eligibility for energy assistance programs. As Mr. Quist has pointed out, there were a series of 4 issues brought to our attention. I'll quickly go through each of those. Issue number one was around OHEP programs will transition to categorical eligibility determination to simplify the process for the households we serve. And there's a couple of ways we want to make sure we do that. We will align OHEP with the rest of the safety net programs, such as temporary cash assistance, supplemental nutrition assistance program, temporary disability assistance program, public assistance to adults, and medical assistance. We will partner with community partners across the state who are currently under contract, who will continue to provide outreach and assistance and really listen in to how we can change that. Clients who are reaching out to us for help shouldn't have to tell the story multiple times, and we should be much more streamlined and efficient about how we do this. The local administrating agencies contracts are currently on a year-to-year basis, and the new expected functions at the LAA are also being finalized at this time. Therefore, the amounts in the budget for fiscal 2024 will remain unchanged until we align OHEP with the rest of the programs, and we'll actually be curious about how that'll roll out in the next couple of months. We'll have more data for you at the end of the fiscal year. On to issue number 2. This is about the department working closely with specific counties and organizations who have struggled. Some of the data that Mr. Quist pointed out is essentially the inconsistency in performance, right? So we reached out to them, and specifically our team is working with Prince George's County Department of Social Services, the Washington County Community Action Council, the Southern Tri-County Community Action Committee to learn what is happening and how we can partner with them to address these unique challenges. They then in turn shared with our team that there were sort of 3 main themes, although there were lots more nuance. One, continued staff turnover and staffing resources writ large. Again, not surprising given the pandemic. Increased volume of applications, and specifically the implementation of the new low-income household water assistance program, or LIWAP. So we hope to see some greater consistency the next couple of months there, and we're certainly going to use performance to look at how might we help our partners figure this out over the next couple of months. On to issue number 3 on page 28 of your analysis. This is about DHS monitoring LIWAP expenditures. And we want to make sure that we work with the Department of Budget and Management specifically for continued funding of this much needed program and partner with our local jurisdictions to strengthen our reallocation methodology. Again, when I sort of step back and hear Mr. Quist say 55 days, one has to ask oneself, why that number? That seems a little bit too long for me, for someone whose water bill or heat or gas is going to be shut off. So how might we together come up with some new standards and increase consistency across the state? Again, no magic wand, but at least trying a different way of approaching this challenge. Finally, on to issue number 4, page 28 of your analysis. This is about working more closely with DBM, DHCD, and our department, who play significant roles in the management and distribution of LIWAP funding. So we will continue to work with them because they have a window into other parts of the state and departments that we don't get to see every single day. So working closely with DBM and the Department of Housing and Community Development to coordinate and streamline our work to avoid duplication of efforts and spending extra money that we shouldn't be spending. Of note, there exists within the applications now attestation language that is confirmed by our clients when they sign up for assistance. And this essentially helps us and them avoid what is referred to as double dipping. So again, holding ourselves as staff accountable, as well as our partners, as well as our clients. So we're all on the up and up here. We work with DBM, who regularly cross-checks data across the departments, specifically Water Utility Assistance Program, which is administered by DHCD, and the Low Income Household Water Assistance Program, to make sure that we are avoiding duplication. So again, data technology as one of many vehicles to better understand how to reduce those kinds of confusion, duplication of efforts. This concludes our testimony, and we'd be happy to answer any of your questions.
Well, thank you very much, Mr. Secretary. And thank you for everything you're doing. Your collaboration and, accountability is recognized, and certainly don't seem like an acting secretary. You seem like a doing secretary. So
Thank you.
I don't see any questions. Thank you very much,
Certainly.
Secretary. Appreciate it. Colleagues, we do have a couple of public witnesses. Just remind the public that you have 2 minutes, and I'll first start with Laurel Peltier and Cindy Carter. Please start in any order you wish. Welcome. Glad to have you here.
Very nice to meet you. And we're going to read the room. We're going to go super fast and do it in a minute. This is part 2. We've been over in the House. We had amazing. We already have our meeting set up. I'm Laurel Peltier. I'm the chair of Energy Advocates Coalition, and all we do is think about low-income utility bills and how to get them lower. They're super, super high. Energy assistance is it. It's the biggest way for people to get immediate grants, big ones, super big ones now. And it's music to our ears about the reporting. I'm the person who pulled the only denial rate reporting for the last 20 years. I went through 660 files on the Public Service Commission website. We just haven't had reporting. And the biggest thing I wanted to share is 3 points. One, denial rates have increased since 2010 consistently. And that's important because that's not just the pandemic. It's not just MD Think. And I think everybody understands there's a lot in the process to be fixed. Secondly, your service you get is consistently inconsistent across this decentralized system. It's clear. That's the coolest thing you talked about. The third one I want to bring up, though, is something a little touchy, and that's MD Think. I imagine everyone's been talking about this, but in both of us are on the state low-income working group too, that came out of Chairman Davis's HB 606 in 2021. We have been collaborating and working hand in hand with many of the people behind us, trying to come up with just super simple, low-hanging fruit to fix this system. But what I wanted to share is MD Think is the consumer portal. And of the 4,000 applications that people send in online every month for OHEP, only 500 of them are pressing send. So the chunk of those applications just aren't finishing up. We have an 8-page report that came out of our low-income working group. So that's MD Think is our online consumer portal, and it's just a bust. And I really, as I said before, I recommend everybody do an application through it. It's a great concept conceptually, but it hasn't been come to fruition for consumers. So we ask for the reporting to make it public by jurisdiction and by intake. Is it online? Is it in-house? And we're going to send it to everybody and just say, please, this stuff has to happen this year. So we'll just make a formal request to you all because I think it's time to go. Thank you. I appreciate your time.
Good afternoon. I'm Cindy Carter, co-founder of the Critical Medical Needs Program and executive director of Cancer Support Foundation. For 18 years, I've been trying to keep the most vulnerable group of population, their lights and their heat on. The OHEP process is more than a little bit challenged. My clients are not able to do online portal, period. So I was told by a very wise Senator Middleton many years ago, don't come down with a problem unless you have a solution. So we have done that multiple times. We got the Critical Medical Needs Program passed into law in 2019, 86% success rate with this program. I'd like to see this budget include money to have that concept and that program in the locals, because right now, unless you are able to find a navigator who is a volunteer, and unless you're able to work with that person, you're not able to get into critical medical needs. So most of our vulnerable population is not able, and it's not just cancer, it's for anybody with any medical challenge. People are not able to get into that program. We pass other bills, the redetermination, we've gotten all sorts of things taken care of from a procedure point of view, but unfortunately, they're not consistently processed and used across the state. The low-income task force group, it just the other day worked with getting the communication between OHEP agency and the customers, just some of the simple things that change, the approval letter, the denial letter, different things that communicate with the customer really what you need to do. These letters before now, I mean, I don't understand, and I've worked with this for many years and years and years, but I do not understand what the letters are asking for, what they're saying. So there's lots of things that are going on that are positive. I do want to leave today on a very positive note. I've worked with 5 directors of the OHEP department. The last year and a half is the first time I've had any glimmer of hope that we're actually got a chance to make things change. So I'm hoping that the department takes care of making sure that the people that are there now in OHEP stay in OHEP and are supported and help to get programs to grow. But there is a light at the end of the tunnel, and I'm very, very excited about that. Thank you.
Well, thank you very much to you both for that testimony. Colleagues, that concludes today's budget hearings. I hope you all have a very wonderful weekend. Take care, everybody.
Thank you.
We're adjourned.